Hello and welcome to the Special Care Baby Unit, Regional Hospital Mullingar. Here we look after babies from 32 weeks onwards. If your baby comes to us for extra support following birth, they may be with us for a few hours, days or weeks depending on their needs. We have a dedicated team made up of nurses, doctors, physios, feeding specialists, along with many others that will help your baby along their journey. We are a family-centred unit and encourage you to visit and participate in your baby's feeding and care as much as possible. We also have a parent and baby room so you can stay with your baby to adjust before you take your baby home. If you need us, we look forward to welcoming you.
You put your cold water in first, you add your hot, you just check it with your elbow. If it's comfortable for your elbow, it's fine for the baby. It's about 36 degrees centigrade, the water temperature. You put your hand underneath the baby's head like that. You just took the baby under your elbow resting on your hip. Now I'm holding the baby in the same position and I'm going to wash the baby's hair. So just wash it nice and gently. This is a very good baby. And I'm going to come back onto my mat. And I'm going to lie the baby back down and I'm going to dry the baby's head well. Babies lose a lot of heat from their heads, so make sure that you dry the baby's head very well. Now, when you're lifting the baby into the bath, just turn the baby over on its side, over in this position. Just put one arm, your left arm, underneath the head and hold on to the left arm. And put your right arm underneath the bottom and hold on to the left leg. Now you see there is no way this baby's going to fall on me. I've got the head well supported with my arm here on the left and I've got a good grip of the baby. Now nice and gently you're going to let the baby into the bath. If the baby's enjoying it, of course, just leave them in for a little while. Babies are very used to water from being inside, so they love the sound of the water. I'm going to lift the baby out again. Now you see I'm lifting the baby out nice and gently. So you settle them down, give them a little cuddle. Settle them down and then you're going to dry the baby off well. Don't forget areas where they can get sore if you leave them wet. All babies are quite fat in here, so get right in there under the chin, because if you leave areas wet they're going to get red and sore. They're all get right onto the armpit here where they're like that, and another areas get right onto the behind the knees and in the groin area. They're areas that can actually get sore if you leave them wet. So you make sure that you dry those areas off very well.
After your baby is born, the cord is clamped and you are left with a stump where the umbilical cord was. Every time you change the baby's nappy, you check the cord stump to make sure it's not red, swollen or oozing. The cord will fall off itself after 5 to 15 days, so just keep it clean and dry and you don't need to worry about it. Just make sure the cord is clean, and if needed you can take cool boiled water. This means water that was previously boiled in the kettle and left to completely cool, and using a piece of cotton wool, gently clean around the base of the stump and most importantly dry the stump after you've cleaned it. When you change your baby's nappy, make sure to fold the nappy down underneath the stump to make sure it's not getting rubbed on. If there is any oozing, redness or foul smell, contact your healthcare provider.
Congratulations if you've decided to breastfeed. This is the best start in life you can give your baby. Breast milk is unrivaled as the ideal food. Not only has it the perfect mix of nutrients, but also all of the infection-fighting antibodies your baby needs. However, like anything, breastfeeding is a skill that needs to be learnt, but once it's established, it will give you great pleasure.
Breastfeeding is the very best start you can give your baby in life. It is a very special, unique formula, tailor-made for babies. It actually protects your baby against all known infections, particularly ear infections and chest infections, and also protects your baby against viruses. We now know that breast milk also helps develop your baby's nervous system. For you, breastfeeding is really good. It helps you build up a unique bond with your baby, because when you breastfeed, you release lots of lovely hormones that help and aid this bonding. It also helps you get your figure back, because you burn up 500 calories more per day when you breastfeed. And it has a great protection against ovarian cancer, breast cancer and osteoporosis.
While you're still pregnant and in the early days after the birth, your breasts begin to produce a substance called colostrum. This is extremely easy for your baby to digest, making it the perfect first food. The first hours after delivery is the ideal time to get started on your breastfeeding.
Breastfeeding on demand is recommended with breastfeeding. That doesn't mean leaving the baby asleep all day, particularly in the early days and weeks of breastfeeding. Babies should be woken up every 3 to 4 hours if they're not demanding feeding. However, breastfed babies can often feed much more frequently than that.
How your baby is attached to the breast is key to the success of breastfeeding. This is called latching on. When your baby is in position, wait until their mouth is open wide. You can tease it open by gently pressing the upper lip with your nipple. Bring your baby to your breast, the chin and lower lip first. Baby's mouth should cover all your nipple and about 1 inch of the brown circle, the areola, around your nipple. Your nipple should touch the roof of the baby's mouth with his tongue underneath. Once your baby has a good latch on, there'll be a period of quick suckling to get the milk flowing, and then rhythmic suckling. When your baby is properly attached to your breast, you'll notice that his mouth is wide open with a big mouthful of breast, and his top and bottom lip are curled out, like the letter K. His cheeks are full and rounded, and his chin is pressed into your breast. The suckling pattern changes from short sucks at the beginning to long, deep sucks with pauses.
There are many different ways to position and attach your baby, but there's some key principles. So I'm going to talk you through a number of different holds. The first thing I would say to mums is get yourself comfortable.
Finding a position that suits you and your baby is important for successful breastfeeding. Make sure you're comfortable and well supported. Use pillows or cushions if necessary. And whether you're sitting up or lying down, keep a drink close by, and most of all, relax.
There's some new research out on a new position for breastfeeding called biological nurturing, and this actually works very well in attaching a baby on a breast. In this position, the mother is not sitting up bolt right upright or lying down. She's semi-inclined and she's lying the baby on top of her body. And in this position, the baby actually self-attaches. This hold now, if you put the baby in what's called the crook of your arm, lying along your forearm, and position the baby with its tummy to mummy's tummy. We call it tummy to tummy. With the baby in a straight line, and if you tuck the baby's bum under your other breast, it makes for very good alignment. Then we encourage mothers in the early days of breastfeeding to support their breast with feeding. You can do this by going in onto the breast with a C hold. Now, mothers often instinctively go in with a V hold, but that'll actually make your nipple very sore. So if you support the breast in a C hold with the under finger well away from the areola, that will actually make a very good shape of the breast for your baby. It's tummy to tummy, it's nose opposite nipple, and it's a C hold on the breast, and when the baby opens his mouth, you bring the baby swiftly onto the breast. So we say bring the baby to the breast and not the breast to the baby. This will actually make for very good attachment. Another variation of this hold is actually something called the cross cradle hold, and a lot of new mums like to initiate this with breastfeeding because they feel they have a lot of control in the actual initiation of the latch. In this, it's similar to the first hold, except you're doing the C hold with your other hand, and you're holding the baby's back and neck with the baby in straight alignment again. So it's very important that you hold the baby's back and neck, and again you're supporting the breast in a C shape. And you're bringing the baby to the breast, waiting for the baby to make a large open mouth, and when it makes a large open mouth, you're swiftly bringing it onto the breast, and then you can put your arm around the baby like this and relax into a nice comfortable breastfeed. There's another hold you can use for breastfeeding called the rugby hold or the football hold. So in this hold you support the baby's back and neck, let the baby lie along your arm and tuck the baby underneath your breast. And in this position you use the same principles of nose opposite nipple and bring the baby to the breast with a wide open mouth. This is a very good position to use for babies, particularly twins. Another way of breastfeeding your baby is lying on your side with your baby tucked up beside you. A lot of mums breastfeed lying down in bed, particularly late during the night. With this, the mother lies on the bed with two pillows, usually her head on the pillow and her shoulders on the bed, and tucks her baby up beside her, nose opposite nipple. Again, it would be the same principles of bringing the baby swiftly onto the breast when the baby makes a wide open mouth. This is a really comfortable way to feed a baby. There are lots of good indicators that breastfeeding is going very well by looking at your baby's output. In the first couple of days, the babies have very little wet nappies, and ideally one wet nappy. Day 1, 2, day 2, 3, day 3, and when your milk comes in on day 5, the baby will normally have about 6 wet nappies in 24 hours. This is a really good indication the baby is breastfeeding well. Another very good indication is actually looking at the stools. And babies have meconium stools for the first day or two, and they have a changing stool which is usually black, green or brown, day 2, day 3, day 4. And when your milk comes in, a baby who's breastfeeding really well will have 3 to 4 yellow seedy stools in 24 hours. If your baby has these sort of stools, the baby is breastfeeding very well.
Your breastfeeding is going well when your baby is alert and waking for feeds, has a minimum of 5 or 6 wet nappies and 2 soiled nappies per day after the first week, has gained weight, sleeps and settles during the day, and is feeding comfortably and pain-free.
If a baby is not correctly latched on your breast, you won't see rounded cheeks, you'll see dimpled cheeks. You'll also see the baby doing very short little sucklings as opposed to long rhythmic sucklings, or you may see a lot of the areola. In that case, you also may feel a lot of discomfort feeding. So if that happens, it's very important to break the latch and start again. And the best way to do that is actually put your finger into the baby's mouth and let the baby actually suck on your finger and break the latch very gently. Signs that breastfeeding may not be going as well for you is if the baby is not wetting and dirtying its nappies. So particularly in the early days, if you look for urates in the nappy, which is pink staining, and if the baby is not passing sufficient wet and dirty nappies, it would be very good to contact a health professional to help you with your breastfeeding.
The postnatal period is from delivery until 6 weeks after the birth. Some complications that can occur during the postnatal period may include some of the following: the baby blues or postnatal depression. The baby blues usually occurs on day 3 or day 4. You can find yourself becoming more tearful. We would advise that if these feelings persist for longer than 2 weeks, to attend your GP. Breastfeeding problems can also occur, such as an infection of the breast called mastitis. If your breast becomes red, hot or inflamed and you get a fever, this might be due to an infection and may need treatment by antibiotics. And it's important to attend your GP or the hospital for a review. Bleeding can also occur, and most bleeding will happen immediately after delivery. However, some can occur more than 24 hours after the birth. This can be from an infection or some retained tissue such as a placenta membrane. It's important, if you are bleeding heavy or passing large clots or soaking more than 1 pad per hour, to attend our emergency department for further investigations. Perineal infections can occur. This is after often an episiotomy, or if women have a small tear that needs stitches. There's a risk that these stitches can become infected, so it's very important to keep an eye on your stitches. If you notice that you have a lot of pain or are worried about an infection or breakdown of your stitches, do attend your GP or again attend the hospital for a review. We would also advise taking regular paracetamol and ibuprofen for analgesia in the first few days. It's good to keep the area nice and clean and dry, and sometimes if you can let the air at the area, this can be very good to help with the healing process. It's also important not to put anything in the vagina, such as tampons, for 6 weeks to help with the healing. After a cesarean section, it's also very important to keep an eye on your wound and the stitches, again looking for signs of infection like redness, tenderness or ooze. And if you're worried at all about infection, to attend your GP. Women can also sometimes get a urinary tract infection after delivery, and this might present with pain when you're passing urine or urinary frequency, and it's good to attend your GP, as you may need antibiotics for treatments. If you notice that you have any incontinence that's persisting after delivery, it would be important to attend a women's physiotherapy or your GP. Blood clots can also sometimes occur after delivery, and women are at an increased risk of blood clots after the postnatal, in the postnatal period, or after they have a cesarean section. Another thing to note after a cesarean section is that you shouldn't drive for 6 weeks, as you use your abdominal muscles to brake, and you should avoid lifting any heavy items. Important to talk about contraception after you have a baby. So after a cesarean section, we would probably advise waiting about 18 months before your next pregnancy to give everything a chance to heal. The progesterone only pill is recommended, and this can be commenced straight away. It's important to try to take it at the same time every day, and you can take it back to back without any pill-free period. Other forms of progesterone only include the Mirena coil, which lasts up to 5 years, or the Implanon, which is a little bar in your arm, and that can last up to 3 years. The combined oral contraception pill is not really recommended to women after they give birth, because it can increase your risk of getting a blood clot, and also it can reduce your breast milk supply if you're breastfeeding. And your midwife can discuss all this with you before you're discharged from the hospital. Thank you for your time.
Hi, I'm Carolyn. I run the perinatal mental health services here in the Regional Hospital Mullingar. Pregnancy and birth are profoundly emotional experiences. Having a newborn baby is exhilarating, exhausting, and physically challenging. The sense of responsibility can be daunting, and the sense of inadequacy and guilt can be overwhelming. The baby blues are very common and considered normal. They usually begin on day 3 after your baby has been born. You may be more tearful and emotional than normal. You may feel irritable and isolated and lonely. These feelings are unpleasant, but usually pass between 1 and 2 weeks. If the baby blues get worse or last for longer than 2 weeks, or if your mood becomes very low several months after your baby is born, you may have postnatal depression. It is thought that 10 to 15% of new mothers will develop postnatal depression, and it can last for months or even years if it is not treated. Your family and friends may notice that you have postnatal depression before you do. The signs and symptoms of postnatal depression include feeling sad, anxious and alone. You may feel guilty, irritable, and angry. You may experience panic attacks. You may not enjoy being with people or even your baby. Other symptoms of postnatal depression include crying easily, feeling rejected by your baby, worrying a lot about your baby, loss of appetite, feeling inadequate, feeling tired all the time, and problems sleeping. Get help from your GP or public health nurse if these symptoms last for more than 2 weeks. The most important thing you can do is ask for help.
Erythema toxicum, also known as erythema toxicum neonatorum or toxic erythema of the newborn, is a common rash seen in full-term newborns. It usually appears in the first few days after birth and fades within a week. Up to half of all newborns will have erythema toxicum. The rash can be on the baby's face, chest, arms and legs, but usually won't be on the palms or soles of the feet. It's a blotchy red rash with small bumps that can be filled with fluid. Although this fluid might look like pus, there is no infection. Because erythema toxicum doesn't cause any symptoms and goes away on its own, no treatment is generally needed. Follow your doctor's advice about caring for your baby's skin. Call your doctor if your baby has a rash and is also fussy, not feeding well, or has a fever.
When you take your baby home initially, babies don't know the difference between day and night, so they really will sleep and eat and sleep and eat. Newborn babies can sleep for almost 16 to 18 hours a day, so it takes a little while for them to get into their routine. Their tummy's small, so they need to feed frequently. It is important to get the right environment from the word go and to get routines in place. And it's terribly important to keep your baby in the bedroom with you, asleep in their own cot for the first 6 months of their lives. It's important to get the temperature of the room right for your baby. The temperature that's recommended is 16 to 20 degrees centigrade. Make sure your baby's not lying near, a cot's not near a radiator, a window where the sun's shining in. Just that they're comfortable but not overheated. And sometimes if the weather's colder, you may need extra blankets. If it's warmer, you can take a blanket off. The message really is, if it's comfortable for you, it's comfortable for your baby. If it's too hot or too cold for you, it's similar for your baby. It takes a little while for babies to get into a nice routine. This will come eventually, but initially you have to try and establish a nice routine. Feed your baby regularly during the day. Don't let babies go for longer than 4 hours during the day without a feed, particularly breastfeeding babies. Bottle-fed babies generally feed 3 to 4 hourly. Then during the night, when you're putting baby to bed, try and have a nice calm environment. It would be very nice if you could bath your baby before you last feed, because babies can sleep very well after a bath. Settle them down, nice calm voice, a little bit of baby massage if you can. And in the night time, when babies wake up in the night, keep everything dark and dull. No bright lights, no chat to the baby whatsoever. Just feed them, change them and put them down quickly. And soon baby will know the difference between day and night. But that can take a couple of weeks. It's very important that the baby is lying on a good firm mattress, back to sleep, feet to foot. Make sure there's no duvets, bumpers, pillows, nothing that can obstruct the baby's airway. A blanket should be at shoulder level, tucked well onto the mattress. And the blankets that we recommend are cotton cellular blankets. They're the only blankets that are really recommended for the first year of life. It's very important to sleep your baby safely, and the message is back to sleep, feet to foot position. And the reason for this is that the baby can't go down onto the blankets. The only way they can go is up. So it's terribly important to have them feet to foot, back to sleep. And this is also a reason why we don't suggest you sleep with your baby in your bed, because babies can roll under heavy warm duvet and can smother.
My name is Lisa Duffy. I'm a physiotherapist in Regional Hospital Mullingar. I aim to see everyone on the postnatal ward after you've had your baby. I will provide an advice booklet to everyone on postnatal continence and fitness. In the early stages following a vaginal delivery, there may be stretching or bruising of the pelvic floor muscles. These are the muscles that form the floor of the pelvis and are important in keeping us continent. Even if stitches are present, once you have rested for 24 hours and are passing urine, you can start the pelvic floor exercises. If you have had a C-section, it is also important to start these after the catheter is removed and you are passing urine. To do these, tighten your back passage as if holding wind, your vagina as if gripping a tampon, and your urethra as if you were trying to stop your urine flow. The sensation is one of squeeze and lift. If your perineum is very sore or swollen, gentle, quick squeezes will help relieve pain if done frequently. As you get better, try to contract your pelvic floor more strongly and hold for longer, up to 10 seconds. You can also do quick contractions, squeezing quickly and letting go after each contraction. Aim to increase the number of quick contractions up to 10. When having a bowel movement, you can support your perineum with using a sanitary pad or toilet paper wrapped around your fingers. The most effective way to empty your bowel is to sit on the toilet, go up on your tippy toes, lean forwards with a straight back, let your tummy bulge forwards, widen or expand your waist, and relax to open your bowel. When you go home, you can place your feet on a footstool to help bring your knees up. There is a picture of this in your advice booklet. After a C-section, there are a few things you can do in the first couple of days afterwards. When lying or sitting comfortably, take a few deep breaths in and let it sigh out after a few seconds. Do this regularly throughout the day. This is to help your lungs recover after an anaesthetic and helps to loosen phlegm. If you need to cough, sneeze or laugh, support your wound firmly with your hands, pillow or a towel. And if you need to cough up any phlegm, the least painful way to do this is to huff, a short forced sigh through your mouth as if trying to steam up a mirror. In order to try and maintain circulation, keep the ankles moving up and down and round in circles. It is vital that you take care of your back after you've had your baby. When feeding your baby, try sitting with your feet on a raised footstool or pillow and a cushion behind your back. Place a pillow on your lap to support your baby. Swap which side you're holding the baby on. This is good for you and your baby. You can also breastfeed when lying on your side. For changing your baby's clothes or nappy, please use a surface that is at the right height for you and for your baby so that you avoid stooping over. If you have had a C-section, the heaviest you are to be lifting for 6 weeks is the baby. A couple of exercises that aid your recovery postnatally are in the advice booklet to help strengthen the deep abdominal muscles. After you get home, it is important to give yourself a chance to rest and recover. It is very individual as to when you may feel up to going for a walk. The first time you go, perhaps bring somebody with you and just walk a few minutes away from home, turn around and come back. The body is great at recovering, but if it's between 6 to 12 weeks postnatally, you still have any back pain, pelvic girdle pain or bladder or bowel concerns, please contact your local physio department for follow-up.
Respiratory syncytial virus, also known as RSV, is a common respiratory problem that we see in young children and newborns. Common symptoms include lethargy, which also means lack of energy, poor feeding or breathing difficulties. Most healthy infants infected with RSV do not need to stay in hospital, unless your doctor is concerned about your baby's feeding or breathing. Treatments may include hydration, which involves a drip or oral fluids, and sometimes oxygen therapy. Infection with RSV in older children usually presents as a cough or a cold. RSV is spread by direct or close contact with secretions. RSV can live on surfaces such as toys for many hours and for half an hour or more on the hands. Hand washing and room cleaning should help minimize the risk of spread. The incubation period ranges from 2 to 8 days. Isolation of children with RSV infection is recommended, and this can be up to 1 week. Patients with RSV infection shed the virus usually between 3 to 8 days. If you're concerned about your baby, you should contact your healthcare provider for assessment.
What you would do if you're in the situation at home and your baby appears to be choking. This is a situation that we hope you will never find yourself in, but there are a few simple steps that you can take which will really help. You will recognise that your baby is choking because your baby may appear to be crying but no sound coming out, and coughing but absolutely no sound. So what you do is pick the child up, put them across your knee with the head slightly low, and with the heel of your hand give 5 sharp slaps in an upward motion, 2, 3, 4, and watching the baby to see if anything comes out of the baby's mouth, and give 5. Keep a close eye. If nothing comes out, there's no response, turn the baby over, and now you're going to give 5 chest thrusts. So with 2 fingers, again pressing in an upward motion, 1, 2, 3, 4, 5. If still there's no response, repeat again your back thrusts, watching, see if anything is going to come out of the baby's mouth. Again, 1, 2, 3, 4, 5. Don't be worried that you're hurting the baby. It's really important to give a good thrust. Turn the baby over again, and with your chest thrust, 1, 2, 3, 4, 5. You would repeat this 5 times. And if there's no response from your baby, obviously call emergency services as quickly as you can and get help on the way.
For parents, one of the most frightening things that can happen is that their baby stops breathing. Follow these simple steps to administer CPR. Gently stimulate the baby by tapping the foot or squeezing the hand. Shout for help if there's no response, but remain with the baby. Gently tilt the head into the neutral position to open the airway. Have a quick look in the mouth to see if there is anything visible. If there is, lift it out. With the head in this position, check for breathing. Look for a rise and fall in the chest and tummy. Listen for breath sounds. Feel for air from the baby's mouth on your cheek, taking no longer than 10 seconds. If your baby's not breathing, give 5 rescue breaths by blowing gently into the lungs, covering the baby's nose and mouth, ensuring there is good seal and you can see the chest rising. Each breath you give should be approximately 1 second in duration. If there are no signs of life, example eyes opening or limb movement, the baby's heart may not be beating properly and you must begin compressions on the chest. Place the tips of 2 fingers on the lower half of the breastbone and push the chest down gently but firmly to a depth of 4 centimeters. Push fast for a count of 30. Then give 2 breaths, followed by 30 compressions. Continue this sequence for 1 full minute. After this, if you are still on your own, make a call to the ambulance stating your emergency. Return quickly to the baby and begin with compressions, alternating breaths as seen, until the baby responds, or you can hand over to the ambulance.